Now, tell me something about the present problems we have in the NHS. I mean, one of them that everybody has to some extent is funding.
Yes, there is funding to provide the care for the patients which A, they expect, and B, we feel that they need. We are treated unfairly in Mid-Essex because we have less funding than other areas. The first question I have to ask patients when they come in to see me with a problem, and I never thought I'd have to ask this, is, do you have private health? Because if they don't have private health, then a certain amount of rationing comes into what procedures we can refer them for, what treatment we can refer them for, and which speciality we can refer them to. And that makes a huge difference to the care of the patient. Trying to nurse somebody with your hands tied is extremely difficult.
Indeed. I mean, it's a difficult enough job anyway, isn't it? If people were really trying to make things easy, and yet as the years roll by and we're told everything's getting more wonderful, there are more and more obstacles put in our way.
Yes, I think we were told that general practice would be endowed with great funds so that we could look after the patients, refer the patients, do everything for the patient, have everything in-house or in the local, have local facilities. And now we're told we can't refer them for this, that and the other, and we can refer them, but then an invisible entity in the ether bounces referrals back saying, no, we can't refer them for this. And then we are faced with speaking to the patient, trying to explain why we can't get their problem treated or even
just dealt with in a temporary fashion.
Exactly.
But the craziness of it all is that we are told that we were supposed to look after more patients in the community, and we were supposed to cut admissions and so forth, and yet everything that's being done seems to be making it more likely that patients will be admitted because we can't deal with them adequately in the community.
No, that's exactly. It's like it's treating someone with your hands tied. So what's the hidden agenda? We haven't got the money to treat people. We haven't got the places for patients to go, so they're blocking beds in hospital. We have to try and keep patients out of hospital, so we're working harder than ever to see these patients and treat these patients with less funding than in other areas. How do you do it? How do you run your own home finances on that sort of basis? I don't understand what the theory is here.
And the discrimination element makes things worse too, doesn't it? I mean, the fact that you two practices a stone's throw apart should be funded very differently means that you have less backup, less personnel, and are able to do less for your patients who are, let's face it, paying taxes just the same and should be really getting the same level of treatment.
Exactly. A surgery closed, I don't know how far away the surgery is from us, I don't know.
A few hundred yards.
A few hundred yards, on a different scale of funding. The surgery closed, the patients were transferred to us, a couple of thousand patients, they were on a different scale of funding. They haven't brought the funding with them, and they are having less funding here, so in actual fact it's a disadvantage to them to register here, but they want to register here because we've got the general ethos of general practice right. The patient is number one, and it should be, and something's going badly wrong. We're actually disadvantaging patients by having them treated in the surgery because we have less money to spend on them.
Yeah, and I mean, in this particular case, the practice was closed because in the eyes of the old PCT, it was so dreadful that they couldn't let it carry on. And so the patients come to us where they expect to get a better standard of treatment, and yet we're expected to do it on a fraction of the budget.
Yes. How do you make the shoestring budget any bigger? And it's an apology really for these patients, and we owe them an apology because we try to do our best within the realms of the finances that have come with them or not come with them.
Yeah. So, and the postcode lottery extends elsewhere, doesn't it? You can have some treatments in some areas, like IVF, and not have it in other areas. People with cancer, in some areas they get everything that they need afterwards, and yet in this area they're denied some treatment. So it's just unfair, really.
It's an inequity. We have patients registering us from other areas because they've come to live with family, they're ill with cancer, they've had their treatment, but they don't want to stay where they live for the follow-up care because they want to be with family. They come to our area, to Mid-Essex, and they find that actually they would be better off where they came from. And how do you explain that to these patients?
Not easy.
No.